Welcome to our brand new career battle series where we compare two different medical career options to help you decide which is the best path for you. We'll break down compensation, lifestyle, length of training, and the pros and cons of pursuing each career path. Dr. Jubal, MedSchoolInsiders.com. In the first videos of the series, we covered the differences between doctors and surgeons and diagnostic and interventional radiologists. Next up in the battle arena by popular request is neurologist versus psychiatrist. Let's break it down. What are the key differences between neurology and psychiatry? To keep things simple, neurologists specialize in the brain as an organ and manage things like medical complications from strokes, trauma, and vascular disease. Psychiatrists primarily focus on the function of the mind, such as thoughts, emotions, and behaviors in response to things like depression, anxiety, and other mental health conditions. In terms of patient populations, neurologists tend to work with patients in more medicalized settings and can serve on specialized teams like hospital stroke teams. Neurologists become experts in diagnostic tests and medications aimed at managing chronic conditions like migraines, strokes, and seizures. They are often consulted by the primary medical team taking care of a patient when there are questions about the brain or to rule out physiologic causes of psychiatric conditions. Meanwhile, psychiatrists tend to work in outpatient settings and focus primarily on diseases of the mind, including mood disorders like depression, personality disorders like borderline, and psychotic disorders like schizophrenia. They also perform psychotherapy, also known as talk therapy, which involves speaking with patients to help them identify and change unhealthy thought patterns and behaviors, as well as understand the way they relate to themselves and others. Whereas neurologists are able to use advanced imaging and diagnostic tests to nail the diagnosis, psychiatrists rely more on the clinical relationship, direct observations, and, when appropriate, input from those close to the patient to help clarify the underlying issue. Now, there are countless exceptions to these generalities, especially when considering all the different subspecialties and clinical settings that either can work in. After all, the line between the brain and the mind is blurry. Subspecialties like behavioral neurology and neuropsychiatry demonstrate how these two can overlap in interesting ways. Additionally, many psychiatrists work in inpatient medical settings, many neurologists work in outpatient settings, and both can work in research and legal settings. Now, how is the training different between neurology and psychiatry? Both require 4 years of medical school and 4 years of residency training. Psychiatry residency requires 1 internship year, followed by 3 years of dedicated psychiatry training in a variety of settings, including inpatient, outpatient, emergency settings, and consultation on medical wards. Psychiatry residents also maintain outpatient panels where they learn the art and science of therapy and prescribing medication. Neurology residents also begin with an intern year, followed by 3 years of neurology training. The settings they rotate in include inpatient neurology units, outpatient clinics, neuro ICU, stroke care, and procedural training as in EEGs and lumbar punctures. The total amount of time for basic specialization is the same, but many in both fields go on to complete subspecialty training. For psychiatry, popular areas for subspecialization include child and adolescent psychiatry, addiction psychiatry, forensic psychiatry, geriatric psychiatry, and consultation liaison psychiatry. We cover all these and more in a previous video on the many subspecialties available to psychiatrists. But in general, neurology has many more subspecialty options. Popular subspecialty choices include vascular neurology, which deals with strokes, neurocritical care, epilepsy, movement disorders, headache medicine, neuromuscular medicine, multiple sclerosis and neuroimmunology, behavioral neurology and neuropsychiatry, and neuro-oncology. Interestingly, both specialties are able to subspecialize in sleep medicine as they are certified by the same governing board. That's the American Board of Psychiatry and Neurology. Check out our So You Want to Be a Sleep Medicine Doctor link in the description. What about compensation? Salaries between neurology and psychiatry are comparable and can vary widely based on practice location, experience, and level of care. Currently, neurology salaries are slightly higher on average. In 2024, neurologists reported making $348,000, while psychiatrists reported making $333,000. It's worth mentioning that, unlike most pediatric subspecialties, child and adolescent psychiatrists actually make more than their adult counterparts on average, with many flexible private practice and virtual options. Now, let's talk lifestyle. Psychiatry generally offers more flexibility, fewer calls, and better work-life balance. The hours in psychiatry are typically more predictable, which is also true during residency training. While inpatient psychiatry positions can be intensive, these hours are typically self-contained. Psychiatrists also enjoy the flexibility of shift work when working in emergency and medical settings. In the outpatient setting, psychiatrists have a great deal of control over their schedules and availability. There tend to be fewer after-hour emergencies that require a psychiatrist on site as well. Many psychiatrists work in private practice, where they craft their own hours and clinic policies, and compensation can be much higher. Additionally, virtual psychiatry has become increasingly popular since the pandemic, offering more flexibility and accessibility for psychiatrists and their patients. Neurology roles can also vary significantly, but they generally involve more medical emergencies and hospital-based care than psychiatry. Neurologists frequently manage acute conditions, such as strokes, seizures, and neuromuscular crises, which often require urgent evaluation and intervention. Because of this, neurologists working in hospital settings, particularly stroke neurologists and neurocritical care specialists, tend to have more unpredictable hours and overnight calls. Neurology residency is also known to be more demanding, with longer shifts and frequent overnight calls, especially for those training in large academic medical centers with high patient volumes. Many neurology attendings cover after-hours call, particularly in stroke care, but those in general neurology or subspecialties like headache medicine or outpatient movement disorders may enjoy more regular clinic hours. That said, neurologists in private practice often have better work-life balance than their hospital-based colleagues. Additionally, fields like electrodiagnostic neurology or headache medicine tend to have more controlled hours with minimal emergencies, making them attractive options for those prioritizing lifestyle. Let's consider the pros and cons of becoming a neurologist. Neurology is an area of medicine that's seen drastic improvements and advances over the past few decades. This is likely to continue since neurological diseases are consistently some of the most funded by the NIH each year. Neurology has great work-life balance, as much of it is outpatient. Most neurologists work a regular 8 to 5, but note that those working in private practice may need to take call from local hospitals. If you prefer more diagnostic certainty, procedural work, and subspecialty options, neurology wins out. Neurologists also tend to work alongside hospital medical teams and can receive higher reimbursements for procedures like lumbar punctures, electroencephalograms or EEGs, and even Botox for migraines. Neurologists also have the opportunity to form longitudinal relationships with their patients since many neurological conditions are chronic in nature. However, psychiatry definitely wins out when comparing longitudinal relationships with patients. Neurologists are often expected to see more patients in a given day, which translates to shorter appointments. Compared to psychiatry, other cons include less job flexibility and higher burnout levels. Many chronic and debilitating neurological diseases, like ALS, currently have no effective treatments. Becoming a neurologist comes with a heavy emotional toll. They need to be comfortable with palliative and hospital care, something most psychiatrists won't need to deal with. Now, what are the pros and cons of becoming a psychiatrist? Some pros include the relative boost in salary over the past 15 years due to increasing awareness and legislation requiring insurance companies to match compensation for other specialties like neurology. The Mental Health Parity and Addiction Equity Act, or MHPAEA, is a federal law passed in 2008 that aims to ensure individuals with mental health or substance abuse disorders receive the same level of health insurance benefits as those with medical or surgical conditions. Additionally, the lifestyle is quite flexible. Many psychiatrists own some portion of their own practices, allowing them to set their own policies and work hours. But, of course, it's not for everyone. Psychiatrists often deal with difficult patient populations, such as those living with severe mental illness, personality disorders, trauma, and substance abuse. The emotional labor involved can be quite taxing. Despite this, psychiatrists generally have lower burnout levels than other specialties, and most report finding their work very rewarding. The nature of psychiatry is quite unique when compared to the vast majority of other medical specialties. Not all personalities are suited for delving into mental health struggles while navigating increasingly complex social landscapes. If you like procedural work or don't enjoy interacting with patients, psychiatry is absolutely not an ideal fit for you. You may also come across some anti-psychiatry sentiments due to influences such as conspiracy theorists, Scientologists, and cruel psychiatric treatments from decades ago, such as lobotomies, which we covered in our most bizarre medical practices from the past video. So which career path is best for you? Given the degree of overlap, there's not always an easy answer. Do you see yourself enjoying the abstract musings of the inner workings of the mind, nailing a mysterious set of neurological symptoms for a medical team, or some combination of the two? Thankfully, both fields are intellectually rewarding and in high demand. If you thrive on solving complex puzzles with clear answers, neurology may be a better fit. However, if you find deeper meaning in long-term therapeutic relationships, psychiatry could be the one for you. In general, psychiatry is thought to have a better lifestyle, and many surveys of attendings show that it's one of the most flexible and satisfying specialties. That said, it's not for everyone, and the emotional investment and mental energy required can be strenuous. Neurology relies heavily on the localization of findings and involves more acute care settings like neuro-ICUs, often with higher call burdens. However, every program is different, and there are areas in both specialties that are more or less challenging. Ultimately, the best choice depends on what excites you most. Is it unraveling the mysteries of the nervous system or guiding patients through the intricate landscape of the mind? Either way, Med School Insiders is here to help, whether you're just beginning to explore these career paths or preparing to craft a competitive residency application. No matter which field you choose, having the right strategy and guidance can make all the difference in achieving your goals. Learn more at medschoolinsiders.com. What medical career paths would you like us to cover next? Doctor versus nurse practitioner, or EM versus trauma surgery? Let us know in the comments.